Hey guys, this is Dr. Samir Islam. I want to thank you guys for joining me today. In our video today, we're going to talk about how to take care of your how to treat your reflux without the use of any medications. And we're going to deal with lifestyle changes that you can do to help out your reflux. And you'd be surprised how easy it could be to change up a couple things, whether it's your diet, the way you live, or where you eat, to help out some of your heartburn and reflux symptoms. And so let us begin. So to start off, let's talk about our definition of what reflux is. So remember, reflux is heartburn is the reflux of gastric contents from the stomach into the esophagus, causing troublesome symptoms. The typical symptoms of heartburn reflux includes burning in your chest or heartburn or regurgitation. Some of the atypical symptoms include chest pain, hoarseness, coughing, asthma, or globus, or the sensation of something in the back of your throat where you have to keep on swallowing and swallowing and swallowing. But there are other associated symptoms, including upset stomach, indigestion, pain, bloating, and nausea and belching as well. Some of the risk factors for reflux include obesity, hiatal hernia, medications, and pregnancy. These are all some of the risk factors that make reflux worse. And as a background, remember, we can diagnose reflux just with the history alone. If you tell us that you have typical symptoms of burning in your chest or regurgitation, that in and of itself has a very high chance of diagnosing reflux without any need for any further workup, especially if you don't have any warning signs. And for some of these patients, we can do an empiric trial of medical therapy to help out with your symptoms. But we typically do recommend upper endoscopy or an EGD if you have these warning signs, which include things like symptoms over the age of 50, difficulty swallowing or painful swallowing, nausea or vomiting, weight loss, bleeding or iron deficiency anemia, or getting full very, very quickly. And this typically is upper endoscopy is also done if you have symptoms that are refractory to treatment or you have a history of erosive esophagitis. So that's kind of a background from the previous talks that we did before. Now, reflux happens whenever you actually have problems with the lower esophageal sphincter and contact actually goes up into the esophagus, causing things to regurgitate or cause burning to occur. And usually it's this problem with the relaxation of the sphincter that's there that causes things to flip into the esophagus. And so there are several things or foods that you may eat that make it more likely for the muscle to relax. And these include things like alcohol, high fatty foods, tight clothing, increased waist size, or being overweight or obese. These are things that typically will cause that sphincter to be open longer and more frequently, causing the symptoms of heartburn to become worrisome and more difficult for you to manage. And by avoiding these things, so avoiding alcohol, avoiding high-fat foods, not wearing tight clothing, losing some weight, this will actually prevent that sphincter from being open longer to help out with your reflux and heartburn symptoms. And so weight loss by far is probably the most effective thing that you can do to help out with your heartburn and reflux, especially if you had recent weight gain or your body mass index is greater than 25. By far, this is the easiest and the best thing to help out with your reflux. And for a lot of patients who are obese, losing just a little bit of weight will make a tremendous improvement, not only in how you feel, not only with your symptoms, but it can be good for your overall health. And so losing just a little bit of weight I can almost guarantee you will help out with your reflux symptoms. If you elevate the bed about 30 degrees from where it is right now, this will also help out with your reflux symptoms. That causes the acid to not go up into the esophagus, helping out with reflux symptoms. So elevating your head of the bed just a little bit, 30 degrees, will actually make a tremendous difference in terms of your reflux symptoms. Avoiding late night meals is a very important thing that you can do to help out with your reflux. Typically, you want to wait about 2 to 3 hours before you sleep or lie down after you eat to prevent reflux symptoms. What happens is that whenever you eat, that food is in your stomach. And if you lay down too quickly, that food doesn't have time to digest, to break down. That can cause acid to be built up to allow it to regurgitate or go into the esophagus. And so by making sure that you wait at least 2 or 3 hours before your last meal will help out with your reflux symptoms and make it easier for you to manage these issues. Avoiding some of the trigger foods. There are a lot of foods that can trigger reflux symptoms. I talked about high fatty foods. But some of the other foods include things like chocolate, caffeine, alcohol, or acidic or spicy foods. By avoiding some of these foods, you actually may help out with your reflux symptoms. However, this is not universally recommended, so don't feel like you have to do this. And this is very selective. Some people can have chocolate and not have any reflux symptoms, or some people can have caffeine and not have any reflux issues or regurgitation. So I would just try this and see how you do. You may notice that some of these foods that you enjoy, such as the spicy foods, peppers, pizza, tomato-based foods, may actually make your reflux symptoms or regurgitation worse. So by avoiding these particular foods, you actually may notice yourself feeling better. So in summary, you want to avoid things that can open up that sphincter in the lower esophagus. Things like fatty foods, having tight clothing, being overweight. These will help out. By eliminating these particular triggers, you can make your reflux symptoms a lot better. Weight loss by far is the best way to help out with your heartburn and regurgitation. So even losing a little bit of weight, even if it's not that much, will make a tremendous difference in terms of how you feel. In dietary elimination, the foods that we enjoy eating unfortunately typically will cause reflux symptoms to be worse, whether it's caffeine, chocolate, tomato-based foods. These are things that you may want to try to eliminate to see if you notice any difference with respect to your reflux symptoms. Upcoming, we're going to actually talk about some of the medical treatments that we can offer to help out with your reflux. Some of the things like Nexium, Zantac, Tagamet, antacids, things like that. We'll also talk about the risk factors with these medications. I know there's a lot of things out there in the media that you may have heard about, and are these true? Are they not? Should you worry about these? Then lastly, we'll talk about a procedure that I do to hopefully help out with your reflux. So I want to thank you guys for joining me today. I would love to hear what you guys have to say. Please comment below, like my Facebook page, and I really do think that having an idea of exactly what acid reflux is would hopefully help out with some of the symptoms you may be having. I do this Facebook Live every Wednesday at 8:30 p.m. I would encourage you to join, and if you have any questions, I would love to hear from them. But thank you for tuning in. I look forward to seeing you guys next week. Thanks and take care.